work in several AMR projects at national and European level through a One Health approach. So we wanted to see the potential of the usage of public procurement of innovation to tackle AMR through a One Health approach. And well, let's say that I'm also working with Marie-Cécile Ploy and Olivier Barrot, but they were not here today. So this deliverable has four main content. And one is the review. Sorry. Yeah. So the first part is the review of EU health innovation strategies and public procurement regulations. Then is a review of PPI practices in the field of AMR, a review of AMR innovation in the animal and environmental fields, and a survey on animal health and AMR innovation. So we made an analysis of the EU health innovation strategies at European level, which are starting now, and it's actually very complex. And we wanted to look through the AMR relevance of these regulations and the One Health scope. And well, let's say that looking at all these sectors, the innovation landscape is very limited in the animal and the environment, especially when it comes to vaccines, diagnostics, waste management tools, and alternatives to antimicrobials. And there is a clear lack of a One Health regulatory framework, including the animal and environmental sectors. We also saw that there's a lack of green public procurement criteria for pharmaceuticals and diagnostics. So that means that some countries are taking the initiative to apply green criteria when procuring pharmaceuticals, but this is not standardized across countries. And when it comes to diagnostics, some of these criteria are applied to diagnostics that consume a lot of energy, but this is not across the board for in vitro diagnostics. And there are new benchmarking results for innovation across countries, but this is very general when it comes to health, and they are not specific for AMR. So we will give finally, after this deliverable, some recommendations to do benchmarking for AMR innovation. So the second part is about the PPI practices. In the field of AMR, we narrowed down to the European landscape and the RaDAR countries, and we had a look at the European portal, and we had a search through different keywords related to AMR. And well, we prioritize here the three sectors: the human, the animal, and the environment. And most of what we have seen is in the human sector. And here in yellow, you can see that, well, we highlighted the ones that are more innovative when it comes to diagnostics and therapeutics and pandemic preparedness. And for example, the ones that stand out most are the ones developed by DG HERA on the development of a rapid point-of-care antimicrobial susceptibility diagnostic medical device, and also metagenomic sequencing. And also was done through the JAMBRI, so the procurement of a new antibiotic in the European Union. But most of these PPI practices are based on training and capacity building and analytical and consultancy services. There are also PPI practices in the field of surveillance when it comes to whole genome sequencing of pathogenic microorganisms. For example, Acinetobacter and Enterobacteria, and tuberculosis as well. So there is more than this. This is already published in a deliverable that will be circulated soon. So you can have a look at the deliverable to have a more in-depth view. And then in the animal and agri-food sectors, there were some PPI practices observed, but not in the sense of PCP or PPI as we understand in this project. Most of them are also training and surveillance activities for EU agencies like EFSA, and also training methods for veterinarians and farmers. And when it comes to the environment, we found very little. So basically, it doesn't mean that there's nothing, but in the sense of the usage of public procurement, there's more room to do, to work on this. And we found a European survey on agricultural soils that's conducted by the Joint Research Center, where they analyze soil samples in agricultural soils for AMR and other pollutants of emerging concern. We also looked at the same in France, and there's a national portal, and we did a similar search with different keywords and the whole historic. And we found that most of these practices are in the human sector, and the animal and environment are not so well represented. And we also didn't find many, did not find practices on PPI as such, probably because countries are not in a situation to provide with funding to develop therapeutics or diagnostics on their own, and probably they will need EU funding, but that's my impression. And well, most of these practices are based on antimicrobial procurement and diagnostics, and also information management systems like software, and also construction and rehabilitation of research institutions. And we have a breakdown of treatments and diagnostics, and also information management systems. For the first one is basically about procurement of automated diagnostic systems, antimicrobials, mass spectrometry, and sequencing platforms for hospitals, and some rapid tests. And for the information management systems, most of them are on vaccine monitoring and nosocomial infection monitoring. And then we also had a look at Spain and Italy, and we didn't succeed. We didn't have the capacity to do an in-depth analysis on this. But let's say that in Spain, there's two main barriers, an IT barrier and a territorial barrier. The IT barrier is that, well, there's no API in Spain, so you need to basically install a program in your laptop and upload many data files. And only then, if you look by some procurement values, you will be able to look at all this data. But the territorial barrier is that all this data is only available for certain regions and not for the whole Spain. So it was not possible in this project to look at this analysis in the whole Spain. And then for Italy, we did not find a territorial barrier, but indeed there is also a main IT barrier. So there is a consultation portal where you can look at procurements, but you cannot download the data from there. And then from the Agency for Digital Italy, there is an API, but you need a lot of IT resources that we don't have in our team. So I don't think it's impossible, but you need a lot of programming skills and work with large databases to do this, because it's not easy for the citizen to do a search by keywords and analyze the data. So apart from this, we also did an EU survey on animal health and AMR innovation, and it ran from November last year to now. And we wanted to see what innovation research needs are there for animal health. And while the survey is still running, the results have to still be analyzed and published. And this has been in collaboration with industry stakeholders and the Drug Spanish Agency. So if you scan the QR code, you can have a look at the questionnaire. And regarding the dissemination of the deliverable, the survey and the policy brief, we made a huge chunk of work in identifying all these stakeholders, basically procurement networks, policymakers, research funders, EU agencies, industry, and so on, through all these sectors. And this work has been disseminated also, or is being disseminated in different scientific events. For the part on the review of AMR innovation needs, we looked at global action plans and research agendas. And for the global action plans, we had a look at international and EU bodies. But most of these parties, for the global action plans, they publish basically operational activities that are not focused on research needs. So it did not provide much value for this search. So most of the results come from this analysis on the AMR research agendas, which are published by the One Health AMR Partnership, the Quadripartite, the Partnership on Animal Health and Welfare, and then other EU agencies. And these are mainly working on water and soil, but there is not much on the air compartment. So we identified a series of common and specific needs across all these sectors. And we basically made a distinction between material and immaterial innovation when it comes to goods and services. And yeah, there's diagnostics, therapeutics, or detection and treatment methods, and vaccines, alternatives to antimicrobials, and data management technologies. But of course, there's also room for the usage of PPI for operational activities such as training, dissemination, stewardship, IPC, surveillance, and access to therapeutics and diagnostics. And it would have been great to have time and resources to look at the business cases and the scalability of all these solutions, but we only had a review of the strategies behind this. So this is just a glimpse. If you want to know more, you can have a look at the deliverable that it's being circulated now. But most of the AMR research priorities identified are in food-producing animals, not so much in the companion animals or wildlife. And then in the agri-food and food safety, there's also quite a number of priorities identified. So basically all of these tackle vaccines, alternatives to antimicrobials, the exploitation of the phytobiome and the soil microbiome, genetic breeding for animals and plants, and integrated pest management strategies, AI technologies, and wastewater and sludge treatment for crop irrigation and fertilization. And regarding the environment, most of the research priorities are on the wastewater sector, basically chemical and biological threat detection in water discharges and wastewater, and also the application of nature-based solutions. And for soil, there's not much evidence yet, so still working on it from the research side, but there are applications on the usage of nuclear techniques for the determination of antibiotic residues, biotransformation pathways, and their usage to monitor what is the pollution in agricultural soils for this, and also the AMR bacteria through metagenomics and sequencing. And last, well, let's say that we had a dissemination campaign in 2024 on AMR. This has been in collaboration with the EU JAMRAI, which is the project I work on. And you will see here that we created this AMR awareness symbol, which is 2 pills, 2 antibiotics put together. And yeah, you can use it. You can, so the main idea behind this is so that people can increase their awareness about AMR and do a similar thing as they did with the HIV ribbon or the breast cancer ribbon. So yeah, I think that's it from me. Thank you.